to be assessing the cranial nerves. So first we're going to start with the first cranial nerve. This is olfactory. So I'm going to go ahead and have you close your eyes and hold down on one nostril. And you're going to tell me what you smell. So go ahead and close your eyes.
Cinnamon.
Okay, now do the other.
Garlic salt.
Okay. Cranial nerve 1 is intact. Now we're going to move on to cranial nerve 2. This is optic. So just tell me whenever you see my fingers.
It's here. It's here. It's here.
All right. I'm going to have cranial nerve 2 is intact. Now I'm going to go on to cranial nerve 3, 4, and 6. This is ocular motor, transductions, and abductions. Abductions. Now I'm just going to have you follow my finger. Just your eyes. Sorry. All right. Eyes moved with my finger. No shaking noted. Eyes were accommodating. Now I'm just going to cover your eyes on each side with a piece of paper. Alright, no shaking noted. Cranial nerves 3, 4, and 6 are intact. Now we're going to move on to cranial nerve 5. I'm going to go ahead and have you clench your teeth for me. I'm going to feel your mastoid and the temporal. They're firm. Any pain or tenderness when I do that?
No.
Okay, and they were symmetrical. Now we're going to be doing light, sharp, and dull touch, okay? First we're going to start off with the light. So this is light touch. Just tell me whenever you feel it.
Feel it. I feel it. I feel it.
Okay. Now we're going to move on to sharp and dull. This is dull. This is sharp. Go ahead and close your eyes for me.
Dull. 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 Sharp. Sharp. Sharp.
Okay. Cranial nerve 5, trigeminal, is intact. Now we're going to move on to cranial nerve 7. This is facial, so can you smile for me? Shocked face, a frowny face. Okay, cranial nerve 7 is intact. Now we're going to move on to cranial nerve 8. This is auditory. This is when I would be doing the Wine and Weber test. This is when I would use a tuning fork. I would sit it on top of your skull and behind each ear, and I would vibrate it. And you would tell me when you didn't hear the vibration anymore. I don't have one of these, so we're going to move on. We're going to move on to cranial nerves 9 and 10. This is the hypoglossal and the vagus. So I'm going to go ahead and have you open your mouth for me and say, ah. All right, now I'm going to test for your gag reflex.
Okay.
Okay, and I'm going to have you take a drink of water for me. Patient was able to swallow, so cranial nerves 9 and 10 are intact. We're going to move on to cranial nerve 11. This is spinal, so I'm going to go ahead and have you stand up. Shrug your shoulders for me. Move your head side to side. And forward and back. Okay, cranial nerve 11, spinal accessory is intact. So now we're going to move on to cranial nerve 12. This is the glossopharyngeal. So I'm going to go ahead and have you stick your tongue out. And move it around for me. And move it into each cheek. Tongue strength is about a 5 out of 5, so cranial nerve 12 is intact. Now we're going to move on to musculoskeletal. So I'm just going to be looking at your shoulders and your chest. Chest and shoulders are symmetrical. They're even with the body. No deviations noted. No bruising. Skin is pink and no lesions noted. Now I'm just going to be looking at your back. Back is symmetrical. You're feeling down your spine. Spine processes are intact. Skin is pink. No bruising. No lesions noted. I'm going to go ahead and have you bend down and touch your toes. I'm going to be feeling for scoliosis. Alright. No scoliosis noted. You can go ahead and stand up for me. Now we're going to be moving on to the spine. So I'm going to go ahead and have you shrug your shoulders and head forward and back and side to side. Full range of muscle in the spine. So now I'm going to go ahead and have you lean forward, lean back, and twist each side for me. Full range of motion in the cervical spine. Now we're going to go ahead and move on to TMJ. So I'm going to go ahead and put my fingers right here. And open and close for me. And side to side. And front and back. Alright, any popping or clicking when I do that?
No.
Okay. Now we're going to move on to the strength of the sternomastoid muscles in the trapezoid muscles. I'm going to go ahead and have you shrug your shoulders for me and move your head side to side and forward and back. Muscle strength is a 5 out of 5. So now we're going to go ahead and move on to the upper extremities. I'm just going to be looking at your arms first. Skin is pink, no bruising or lesions noted, temp is consistent all over. Now I'm just going to be feeling your muscles. Any pain or tenderness when I do that?
No.
Okay. I'm going to have you wiggle your fingers, twist your wrists, elbows up and down, brush your hair. All right, full range of motion in the upper extremities. So now I'm just going to test the strength of your upper extremities. So go ahead and stick your fingers out for me and squeeze my hands. All right, and push up, push down, elbows out, push up, and push down. Muscle strength in the upper extremities are a 5 out of 5. So now I'm going to go ahead and move on to your lower extremities. I'm going to have you sit first for me. I'm just going to be assessing the lower extremities. Temp is consistent all over. No bruising or lesions noted. No edema noted. I'm just going to be feeling your muscles. Any pain or tenderness when I do that? No. Okay. I'm going to go ahead and have you stand up for me. Wiggle your toes on one foot. Now the other. And twist your ankle. And in the other foot. And do knee up and out. And up and out. Alright. Full range of motion in the lower extremities. So I'm going to have you sit for me. Kind of scoot all the way back if you can. Alright. And push your feet up. And down. Alright. So now kind of scoot a little bit closer for me. And push out with your knees. And push in with your knees. Lower extremity strength is about a 5 out of 5. Now I'm just going to check my paper real quick and make sure we didn't miss anything. Alright, in the upper extremities for the full range of motion, I'm just going to have you shrug your shoulders for me. Alright, and wiggle your fingers, twist your wrists, arms up and down, and comb your hair. Okay, full range of motion in the upper extremities, and that's the end of our assessment.